You had a really painful abscess. You did quite well. Do you mind spending a few minutes talking about your heroin use?
I already told them that I've been shooting up almost a year, and I'm thinking at some point getting some help, but I just really, I got to go meet someone in a couple hours.
Well, it'll only take 5 to 10 minutes, really.
5, 10 minutes. All right, that's all? All right, Doc, you got 5 minutes.
Thank you. Before we dive into this discussion, I know it's pretty heavy. Give me an idea what your day is like, what your life is like, so I can see it through your eyes.
It all depends what's going on with the people I hook up with. And sometimes, you know, it's just, I have to use every day. You'll have this kind of like uncomfortableness and a little bit of cramping. And once I score, I feel much better.
So you're just trying to feel good, not be dope sick, you mean?
Yeah, because if I'm not feeling okay, then I really have much I can do before I score.
Mm-hmm. What else goes on in your day?
Well, it depends. It depends on if I have enough to get through the day. See, I try to take care of an appointment or something, because I have a daughter, and if I can get maybe some work under the table, I can give her mother a few dollars, and I feel good about that.
That sounds like the daughter's pretty important to you. You're trying to do the right thing. That's great. You're going through an awful lot. Thinking about this abscess today, do you see any connection between your drug use and your abscess?
Yeah, I do. It's where it probably came from, probably from an old pair of works.
Maybe you can help me see it through your eyes, what you like about heroin, what it does for you.
Well, when I score, I'm not worried about like all the problems that I have. I'm not worried about the court case. I'm not worried about the fact that my mom is not doing well. You know, I broke up in my relationship, but I'm still in contact with my daughter. It helps me be able to deal with life.
Deal with life. That's a way of coping with things, and using heroin to help you cope with things. Is that right?
Yeah. That works for me.
To handle, just to help you handle all the troubles. Does it do anything else for you?
Makes things kind of crazy.
Crazy? Crazy in what way? Negative or positive?
I'd say negative, I think.
Mm-hmm. Living with this type of uncertainty, this chaos, what other things do you like less about heroin in addition to that?
Well, the abscess is not helping things out, and dealing with the Department of Corrections.
No.
If I never started using, I probably wouldn't be caught up in doing all this, you know.
You got a lot on your shoulders right now. You remember when you came in here, they had a pain scale with these different faces. 1 was no pain and 10 was the worst pain in your life, and you scored about an 8. So we have this other type of scale I wanted to show you. It's this readiness ruler here. It's like numbers, 1 is not ready to make changes in your life, and 10 is very ready. I was just wondering if you wouldn't show me where you're at. Oh, please be honest. Don't tell me what I want to hear, but be honest.
I would probably say, like a 6.
A 6. Could you point to that?
Yeah, right here.
That's where you're at. 6 is pretty good at 60% ready. Well, tell me, why haven't you chosen a 1 or a 2, something less?
I don't know, because I've been through so much right now, and I'm almost there, where something's got to really change for me. I can't hold a job. My family's on my case, and I got a lot of people coming at me right now.
Sounds like you have some reasons for change.
I don't like living in a shelter. I don't like living in the streets. I wasn't raised this way.
What concrete steps could you take to make these changes?
Steps I would like to take. I don't know.
Something positive, like what's going to help you with your daughter or the craziness in your life?
I really don't know where to start sometimes. Maybe I need to stay away from certain people.
Stay away from this negativity?
Definitely. I mean, because that's what they're all about. They're all about getting high, and sometimes when I'm with them, I don't really want to get high, but it's there, and I'm not going to say no.
Persons, places, and things trying to avoid people that are selling drugs or using drugs, that makes a lot of sense. That would be like step 1 for you.
Yeah, absolutely.
Anything else?
I don't know, maybe I check myself into some kind of program, I think.
No, that's really good that you're seeking help and want help. We have a program here, Project Assert. I can't promise you we'll find you a bed, but we can work together and try to get you someplace as soon as possible. What could you do in the meantime?
I don't know, you know, I mean, maybe cut back a little.
Cutting back makes sense. I'm just trying to go over a few options with you. Another option would be acupuncture. It can reduce the craving.
I've heard of it. I'd give it a try. I'm not sure it's gonna keep me from. I just, you know, I really just need to quit.
I agree. You got a point there. Well, it sounds like you have a good start here, staying away from people that are negative, that could get you in more trouble and keep you out of jail, and going to a detox program. Have you done something in the past that you've been proud of or felt successful about that could help you now?
I haven't been clean for that long, so...
Are there other people in your life, like family or other friends, that could help you in a time like this?
Yeah, I got a cousin. Right now, I think he's something like 2 years sober or something.
That's great. That really is. I think we got something started now, and I'm going to take you over to Project Assert now. But before we go, I'd like to write down some of the things that we talked about today, sort of like as a promise between you and yourself, so you can take this with you. What are some of the steps that you agreed to?
Well, we talked about just staying away from certain people, you know, stay away from certain people.
Stay away from certain people?
Yeah.
Okay.
Check myself into a detox program.
Check into a detox.
Get a bed, absolutely. And I guess maybe the other one is talking to my cousin.
Uh-huh. Well, that sounds like three important steps that you can take. Do you think they'll work for you?
Yeah, I mean, I got to push through, like I said, you know.
And I think you were on the right path. I'll get in touch with Project Assert right now, get you over there, and they can work with you on getting you a safe place, a detox program.
Thanks, yeah. Thanks very much. I mean, no one's ever listened to me, and this is the first time someone's actually sat down and talked to me. I've been to the hospital a lot of times, and all they do is take care of whatever I got going, and then they just check me out. It's the first time that anyone's really sat down with me, and I really appreciate you helping me, Doc.
Well, I appreciate you spending the time. I know you were in a big hurry, but I'm glad you spent the time, because I certainly learned a lot from you and it helped me be a better doctor.